Saturday at what time is the ergonomic setup? That's what I want, because I'm sitting there for a long.
11 a.m. on Saturday. I'm going to do another, I'll send an email out to everyone so that you have another link to hit for that.
There was a quick little on the chat I saw about abdominal surgery. How does that affect your body? Guys, if think about the container and the contents of your body as a whole, okay? Whenever anybody's had, for example, a C-section, this is where you got to know anatomy quite well. You got to know the tissues that they've basically cut through. They've cut through skin, they've cut through fat tissue, they've cut through muscle tissue, then they basically cut through the body of the uterus. All of those, that's necessary to basically have a successful C-section delivery, because the woman can't have a vaginal delivery for whatever reason. So the healing of that tissue is, I always tell clients, it's living tissue. It's just disorganized. It's a scar. Now, does everybody who has that scar have a problem? No. But do a lot of people have that problem? Absolutely. I see it all the time. And it's like a kink in the armor a little bit, where the tissue hasn't moved. And no one's really thinks about it. I get clients who come in and it's been 5 years or 15 years, 25 years, and they have a symptom somewhere in their body. It could be back pain, it could be in their heel, wherever their symptom is. And when you go and investigate it, there's been a bit of a neglect there. Nobody's touched the scar physically and neurologically, okay? Because there's a mapping in your brain. It's called the homunculus. So there's a bit of a smudging going on, and so what that creates is a potential problem later on. When that problem might arise is the question mark. That's complexity. Nobody can put their thumb on it, but you just have to determine, is this a problem area? You have to assess it and recognize it, and then determine if there's some treatment that needs to basically revolve around it. Hopefully that answers your question.
Mm-hmm. Do we have any other questions, guys? And the last thing is, when you guys get these emails twice a week, if you guys have friends or family that you think might be interested in this stuff, just forward them the email. They're more than welcome to join us.
And I will say one last thing, just because we do have a few minutes, unless another question comes up. Jeremy's right, that functional medicine is a big question. But it's kind of like, this is how I explain it to clients. It's layers of the onion. That's the contents part of your body. So functional medicine looks at your blood work. It looks at different ranges of your blood work. Because typically you go to your family physician for that. And we always say, that's fantastic. But sometimes there's, it's parameters. Who falls out of those parameters? And is it creating an inflammatory cascade? In the end, it all comes down to inflammation and how's your body reacting to that? How are the systems of your body managing your health? And that's functional medicine is just another realm where you can get into nutrition and supplementation in addition to everything else that we're doing. It's another level, but it's very interesting and it's detailed.
Yeah, it's like it's trying to find or chase the root cause of an issue. So it's looking at, like he was saying, looking at blood work, stool testing, cortisol levels, organic acids, and to see why do you have a skin issue, a digestive issue, a neurological issue, neurological being brain fog, anxiety, depression, that sort of stuff that's coming from an inflammatory source rather than a traumatic source. So listen, it's a big question. I'm sure we're going to be doing webinars on that, if not in the immediate future, down the road when we're actually practicing it even more so than we are now. But it's definitely interesting stuff. It's going to be a part of the sport, a part of the sports link in the next year or so. Then we got one more question.
I saw a question kind of related to Chiro for when it's not recommended. Yeah. So osteopenia, so just kind of like less density within the bone. I find that like a lot of people have a misconception that if they see me, they need to get an adjustment, but I actually have quite a few patients I don't even adjust. So with those ones, like I would just always based on like the comfort of the patient, if they're even comfortable with adjustments, or for safety requirements, if like you don't have the bone density to tolerate an adjustment, there's always a way to kind of range the amount of force you put into it, or even just like stretching the joints and just getting relief that way. Because you don't really necessarily, not everyone needs an adjustment or even requires it. There's sometimes where you're actually too mobile and you really don't want an adjustment in that area. So there's a lot of times where I don't adjust people, and that's totally fine. We could get other ways with stretching the joints, working on the muscles. It's just not the old traditional chiro approach. If that was the approach where I had to adjust everyone and that was it, then maybe, yeah, it wouldn't be required, but there's a lot of other ways to holistically manage.
Yeah. Great
Guys,
point,
we are out of time. We're out of time. It's going to shut us down in about 30 seconds. Colleen, I'll answer your question on Saturday about stretching your hip flexor without kneeling. Guys, thanks for tuning in. Thanks to our panel for taking time out of their day to do this. And we'll pick off on Saturday. Thanks, guys.
See you later.
Bye.
Bye.